Right. Now, would you find it useful to learn something that you can do for yourself to improve muscular aches and pains that you've have maybe to improve your immune system, to improve your overall health? Now, that's what I'm here to talk about. Would it be useful to have some simple home remedies based on my experience that you can use for simple everyday problems like back pain, knee pain, heel pain, fatigue, headaches? Well, if so, then you are in for a treat. I'm going to talk about something that you can do for yourself during this time while you're locked down at home, at work, or
Good morning,
any other
everybody.
time.
I hope you can hear me. And welcome to HealthFlix. It's really such a pleasure to launch this. This has been a labor of love and a lot of work for a bunch of us over the last 2 weeks. And before I start talking about HealthFlix and the transformation of lives and coping right now during this most challenging of times, I just want to thank everybody who has made this possible. So first of all, anybody who shared this with anybody else, and if after this you continue to do that, thank you. But my gratitude also goes out to...
Hi, so sorry. Don't know what that was. I'll be starting again. Right. So anyway, in a moment, what I'll be doing is talking about acupressure. Pressure on acupuncture points around your body with a practical explanation, and walk through some of these so that you can help yourself and you maybe help your household during these COVID times, to help you gain a new skill and so that you can look after yourself even better, or the people around you. So my name is Dr. Toh Wong, and I'm a full-time GP in England and the co-organiser of the Integrative Health Convention, which is a conference for doctors, therapists, and the public to learn about different forms of conventional and complementary therapies, as well as self-care modalities. We are the UK's largest integrative health conference, and it would be great if you ever wanted to join us. However, we're probably going to hold off for this year because of the current issues, but we'll be around annually, and that's our plan to do so. So I've given numerous talks about integrative health all around the world and in this area, and what perhaps qualifies me is not just the fact that I have studied all the talks of our over 30 speakers every year, but also the fact that I've been practicing acupuncture, hypnosis, NLP on a daily basis. You know, as a full-time GP, we see over 100 patients a week. So I'm so happy that you are here to join me today to learn just the basics of something that I find useful for my patients who are concerned about needles, because usually I use acupuncture. And this is from my experience that I found very useful to perform on them or to teach them to perform on themselves. And so hopefully you can perform on yourself as well. So I hope that you understand that what I'm saying doesn't necessarily have a great evidence base. Because the amount of pressure you apply, the experience you have, it's all different. And it's not a huge amount of research backing, but this is my experience of what works from my use of acupuncture and my personal experience in extrapolating the evidence, which we know that massage does relieve conditions, certain conditions and certain aches and pains, and does really make people feel better and more stressed. And I think any of you who've had any sort of manual manipulation or massage, there's a reason why there is an industry. There's a reason why people do these things. There's a reason why people feel better. And there's nothing wrong with feeling better, which I'm sure you know. And what's even better is you don't have to just be helpless at home. You can have these home remedies while you're not bothering your GP, and where you are protecting, like the saying goes, you're protecting the NHS and you're saving lives when you're staying at home. So I'd like to begin by showing you we're talking a little bit about acupressure. So acupressure is basically pressure on acupuncture points. Acupuncture points are designated points around the body that run along what we call meridians, which are energy channels. So I practice Western medical acupuncture. What we found from the evidence is that if you relieve certain acupuncture points, you have the same effects, right? So you have the same effects. People feel better. People feel more relieved. So the next 20 minutes or so, I'll go talk through some points which are commonly used. So what I'll do is I'll show you some photos and share my screen. So the first one I'd like to talk about is the standard one that's behind the shoulders. So let me share the screen for you and I'll show this to you. Share. This is what we call gallbladder 21. So everyone can see the hand on the back of this person's shoulder. And the way you find this point, where the finger is another point, which is a really good point. That's usually a nice pressure point. This is my favorite point because this illustrates how you find a pressure point. Pressure points are acupuncture points or pressure points are located in a dip, often in a dip of a muscle. And sometimes they are, what you're looking for are knots. So acupuncture points are often knots, tender points. They're often tender points. Not always, but often. And the way you find them is you have some rough guides on location of the points. So in this picture, what you'll see is there's a line drawn. What we do is we find the back of your spine, the bony bit of your spine that sticks out, which is what we call in medicine the C7 spinous process. And we going down to the tip of your shoulders, what we call the tip of your acromion. This is your acromion, which is part of your shoulder blade. And you can see, and if you find a place in between that imaginary line, right in the middle, that's called gallbladder 21. And if you move your fingers perpendicular to the muscle, so the muscle is running in, flowing in this direction. So from your bones downwards. And if you take your hand and you run it across, you'll find some knots. And the way to do acupuncture massage, so in Chinese, this is called Tui Na, which is a combination of different massage techniques, which is usually rubbing and constant pressure. So I'm going to teach you what we call ischemic pressure. Very easy to do. So what we're going to do is you're going to press on these acupressure points, press on the gallbladder 21 or any knot that you find. You can use this on any knot, right? Just press on it. And if you press long enough and hard enough, so what you try to do is relax the muscle, put your constant pressure, and if you can't find it, just use as many digits as you want, right? These are my techniques because they're practical and they're easy. So press, keep the pressure there for about half a minute to a minute. And as you're doing that, what you'll find is that the pressure will get relieved. As in the pressure point, the knot will begin to disappear. So if you do it for a minute long enough, and if it doesn't disappear, maybe you can shift the position a little and press harder. And that's why there are certain devices that you can get. You can get, you can buy certain devices. One of my lady who was going to speak for us this year at the conference is a lovely lady, uses tennis balls. And so she says, lie onto a tennis ball on a relaxed muscle. And that often does help relieve things. So simple homemade remedies. So I'm going to go off the screen for a bit and come back. So that's gallbladder 21, my favorite point. And the way, if you want to massage it, you can do the same, but I would just keep pressure on it. So keep your, feel the pressure, both sides sometimes, or one side. And the thing about acupuncture, you learn that actually if one side is too sore, just treat the other side. And often if you treat the other side, very strangely, the side with the pain feels better. Very, very odd. Now, I'm going to swap back out. Right, good. Now I'm going to see what else I can teach you. So now that you've learned how to do that, we'll talk about my other points. Oh, okay, we'll just talk through them actually. That might be the easiest thing. Right. The next point is gallbladder 20. So while we're talking about wonderful relief of headaches, this is a great point for, and so the gallbladder 21 is my favorite point for relaxation. So often we say the caution with this is if you relieve too much pressure, then someone's head feels a bit lightheaded. So it's not great to do in someone who's pregnant because they tend to have a lower blood pressure and then they feel a bit lightheaded. So when I do, I use this point most frequently for headaches. For migraines, for headaches, they're all the same in traditional Chinese medicine. Usually many headaches have the same cause and we seem to relieve it very well with just using this one point. I use this with just most of my patients, 9 out of 10 of the headaches that I see, and we see at least 10% of all GP consultations are headaches, and often they improve very nicely with me just doing acupuncture for people. And if we can't do acupuncture, we'll do some massage, and this is the point most frequently tense and often people come and they're really, really tense. So this is great for you if you need to relieve headaches and have general relaxation. The other point that we use is gallbladder 20, and this can be found by feeling the bones at the back of your ears, what we call your mastoid process. And the reason it just sort of juts out of your skull, this bone here, is because your sternocleidomastoid, which is this muscle here, joins up to and connects to your skull. And so there's this bit of bone that juts out. It's bigger in men because men have bigger muscles in general, and men have generally squarer jaws because the muscles are stronger. And they pull the bone more. So anyway, this bit of bone that juts out, you follow it round, and there's a dip in the head. And this is, and if you can tell that there's a muscle, there's muscles either side going vertically downwards of your spine, going vertically downwards. And just between that muscle, so on the outside of that muscle and the dip as your fingers go back, is a point called gallbladder 20. And this point, again, great for headaches, great for relieving stress, moving your thumbs in a circular manner, moving them upwards, holding, relaxing, holding, relaxing. But do that. But again, if you find that it's sore, what you could do is just relax as much as you can and then keep the pressure, constant pressure on it. Constant pressure. And after half a minute to a minute, relax. And you'll find that the muscles relax. And it's quite comforting. Again, you might do this while you've got a headache. There's nothing wrong with it while you're doing a headache. You might find it harder to relax while you're having a headache. But often when I do this and someone is having a headache and I relieve the pressure from these points, and we talk about relieving qi, stagnated qi, or your qi is what we call energy, but you know, in real life, they're sort of tender points. If you relieve all this, you feel better. Okay, so next one that's really useful, which you might have heard of, is pericardium, what we call the pericardium 6. And the reason these things have different names is because the WHO says, look, you know, you've got acupuncture where a lot of people are interested in. Everyone talks about different, how do you define these points? So they start saying, look, you're going to do research, you define the points. So for example, this is called pericardium 6. In this point, everyone knows about something called C-bands. In this country, they do anyway. And these are acupressure devices, which are like rubber bands, and then they have a sharp bit, or not a sharp bit, or a knobbly bit that simulates this point. And if you press it, you'll find that it's sore. And how you can find this is we use in traditional Chinese medicine, we use Tsung as a measurement, and we would say this is, to find this would be about 3 finger widths from the wrist crease to and right in the middle, and you'll find a tender point. You can go up and down until you find, up and down the middle until you find, this is my tender point, and you'll know because it's tender. And you can move it up and down in the direction of the, or left and up and down, left and right, it doesn't really matter. You'll find a point. It's sore in all directions, right? So if you find this, it's great for nausea. It's great for general well-being as well, and just for stimulating your immune system. So, supposedly, like I said, the evidence for whether your immune system is generated or not is really poor. But what we do know is that there are studies that do talk about nausea. In fact, they've commercialized the C-bands, and a lot of people swear by using this. And the secret is you've got to find the right spot. And I've done this for pregnancy-related nausea where people can't tolerate the drugs, where they can't tolerate our usual anti-sickness medication, or sometimes they just don't want to tolerate you don't want to expose the baby to drugs, and that's fine as well. So this is an alternative, and this is something someone can do at home. So if someone's got pregnancy-related nausea, this is pericardium 6, just 3 fingers down from your crease, and you'll find one particular point that is very, very tender, and that is this point. Okay, next one we'll do is we'll teach you, this is my favorite point. So people often talk about large intestine 11, so which is, and this is large intestine 10. This is the tennis elbow point. Tennis elbow is really, really common. So my rule in general practice is that I teach my registrars, as I'm a trainer for GPs, and I see lots of medical students. And one of the things that I teach them is that if someone complains of elbow pain on the outside, and if they can do full movement of the elbow, which means you can extend fully, see that's full extension, and you can flex fully, that's full flexion, and there's another movement, you can do supination and pronation. Oh, sorry. Yeah, that's right. This is pronation, this is supination, up, supination, pronation. And if you can do all those movements, there's nothing wrong with the elbow, then it must always be, in general, tennis elbow. And tennis elbow, the way to test it is you can dorsiflex the wrist, you put the wrist this way, in this direction, you cock it up, tell them just keep it there, and then you resist it, and then you push it down, but they have to push up. And then if they have tennis elbow, it'll be sore around here. And for many years, they talk about using this particular point in this muscle called your brachioradialis up here, just next to, and you'll see. But what we've found over the years that what really benefits people is this point called large intestine 10 in the muscle called your extensor carpi radialis brevis. Again, doesn't really matter. And the way how you find it, so again, about 3 fingers down from about 4 fingers, I would say, 4 of your fingers, and the Chinese measurements goes with your fingers, down from the edge of your elbow here on this side, and then you should be able to find a dip in the muscle. But it doesn't really matter, and you'll find a dip. So this man, it's a muscle, you can see this muscle here is quite a large muscle he's got. It's called the brachioradialis, and what we say is outside of that, further away from that, is a dip, and that dip is often tender. And if you can't find it, you can often find a tender point. So if you do that, I wish I was more muscular. So if you do that, somewhere in there, that's right, is a point that's sore. All right. Okay. So, and you'll find that. And if you find that sore point, and if you do have tennis elbow, and even if you don't, you'll often find that sore. And so it's called large intestine 10. So often you'll find that it does relieve constipation, bowel issues, and very strange. If you did do acupuncture, which is a strong stimulation, massage can just be just as effective, but probably not. Acupuncture gets direct to the point. But often you'll find that for some strange reason, not only do people sleep better, but their bowels start moving better. It just moves easier. And it's the strangest thing. But what you learn after a while when you do traditional Chinese medicine or any of the holistic therapies is everything is related to everything else. And I think in Western medicine, we have a lot yet to learn, that everything is related to everything else. especially in these COVID times where we don't know much. So the best you can do is look after yourself, your nutrition. There's a lot of talk about vitamin D deficiency, and I think any vitamin deficiency, any deficiency is probably best corrected, but not overcorrected. I think they're used, a principle in often Eastern medicines is about balance, achieving balance. And I think that's important. In everything in life, it's all about a balance. So this is large intestine 10. So if you find that point, massage it, and the way you can massage, and I often say is you massage, actually not try to, to find these points you would feel perpendicular to a muscle, but to massage it, you would do parallel to muscle. I'm sure you've seen people, you've been for massages, they always massage in the direction of the muscle. So the muscles down here are going this direction, and you do that in that direction. And this is a very famous point called large intestine 4. So this is can have effects everywhere, but this is our general pain point. Where the evidence base lies for this is with acupuncture is that if you use this point for headaches, somehow it works. And I don't understand why. It's in your hand. Like I said, everything's connected, but it's in your hand and it's in the first dorsal interosseous muscle. So what we mean by that is you can see there's a bulge in this picture, and there is the belly of the muscle, and you'll find that it's sore when you press on it. And you'll find it, and if it's not sore, then you'll find another place. And often you can find, if you have like a pen or a pencil, this is a little, that if you have something sharp that's blunt, and you can find that point, and it'll be sore. So find that point, again, press on it. You can do it for headaches. You can do it for any pain, jaw pain, toothache, back pain, in fact. So this is a general pain relief point that you can do. Okay, and the next we have is, this is one of my favorite points, actually. There's so many acupuncture points. They say there are over 1,000 points. I know maybe about a handful, but these are my favorite ones. I do mainly acupuncture by feel these days, and you can feel these points, but they give you a rough guide, and they're different in not exactly the same spot in everyone, but everyone feels the same pain when you press around these areas. They give you a little guide. The way you find this point, again, the way you find this point is that where your ankle bone is, if you put 4 fingers above your ankle, I'm not going to show you my foot, and 4 fingers above the inside of your ankle, and this is the dip between the muscle behind the bone, your tibia, and the muscle in the back called your gastrocnemius. I think there's a muscle complex there. So this is your Achilles tendon. So this is great. Spleen 6 is great for your immunity. So it stimulates your immune system. Again, you massage. If this was your foot, you'd be massaging up and down, up and down, up and down, up and down, up and down. You'll find this tender point. If it's tender, relax it, press constantly for 30 seconds to a minute, relax, press again constantly, 30 seconds for a minute or even longer, and relax. You can massage it up and down. Yes, it will be sore. Chinese massage is something that's not sore. If you think it's not painful, no one's going to pay you any money to see a Chinese massage person. Right? If you come out of it and you think, oh, I feel relaxed, no, you're like, that's a bit sore. In Chinese massage, you've got to feel something, and you've got to feel. Usually, good doctors will give you good relief. So all manipulative. This very, very briefly, I'll tell you about all manipulative techniques. All manipulative techniques are relieve these, what we call myofascial trigger points, knots, little knots. And people have different definitions of what they are. No one quite knows what they are. And so you can relieve this point, spleen 6, and you know what it's really good for? It's good for Achilles tendonitis. Achilles tendonitis is a very common condition with pain in the heel, in the ankle, sorry. In the lower ankle, back of your heel. In fact, pain in the heel is often plantar fasciitis, but people often have tight Achilles tendons. And I would normally teach someone how to do a stretch and you can look on YouTube and they'll tell you how to do stretches on YouTube. But what I'm here to do is tell you that this is a very good point to massage for it, and it'll combine you treat getting better from it. In fact, while I'm talking about plantar fasciitis, which is pain right on the heel, right on the base of the heel, but often this is, if you roll a golf ball, you'll find one particular point that's more sore than the rest of them. And you keep rolling that and you keep rolling that, and until maybe even tears come down your eyes for about 10 minutes or so, you don't have to do it again. That's it. It gets better. And I've done this many times with my patients. Unfortunately, you'll read up on the internet that it says, yes, use a golf ball, but there's no point doing it lightly every day. Do it properly once and then leave it alone. Of course, consult your doctor, make sure that the diagnosis is correct before you start hurting yourself or doing anything serious, okay? Great. So this is the last point I'm going to talk about, and I think is the last point I'm going to talk about, yes, is liver 3. So this is the corresponding point on your foot, as in your hand. So I'm not going to show you my foot, like I said. Again, it's between the first toe and the second toe, and up in a muscle there, you'll find a very, very tender point. And this is great for, again, very strangely, back pain. So once despite keeping fit, once I strained my back while I was exercising, and I continued exercising, and the next day my back was in spasm. And the problem is, I don't know if you've ever had back pain, you've got all these spasms, and then it hurts, and I couldn't, I sat down and I couldn't get back up again. And I thought, oh gosh, what can I do? And being an acupuncturist, I have acupuncture needles all around the house. And I took hold of a needle and I thought, oh, this is a good time to try needling this point because I can't reach my back. So I needled the point in my foot where it was sore. And within a couple of minutes, I was up walking again. It wasn't complete relief. It was still very painful, but I could walk. I could get up from the chair. And it was fascinating. And often people will come and ask to tell me that acupuncturists have treated their feet for their back pain, and often it does work. So it has overall, all these points I've taught you overall have relaxation effects. And there's so many other points, and I'd love to teach you all these other points, but I think that's enough. I think small bits of information, that's what we all require. Sorry, SP stands for spleen. For those of you've asked any questions, there's a question there for it. Any other questions that you have? I think I'll conclude now. But before I conclude, maybe I'll tell you a little story. So, now that you're here, I have a little story, and the story goes a long, long time ago in a place maybe far, far away. And say, Western medicine was just discovering what Eastern medicine could do. And there was this famous Western professor, Professor of Western medicine, who had heard about this famous Eastern doctor, and who practiced acupuncture, acupressure, and traditional Chinese medicine. And he heard all about all these miracles that had happened, that were happening. People were doing operations under acupuncture. People had pains for years and months, all being cured in just a few sessions or immediately. And this is not unusual. This is not unusual. So this gentleman, so the professor of Western medicine came across and visited this doctor of traditional Chinese medicine. And very haughtily, the professor of Western medicine, he says, I don't believe in these so-called miracles. He said, tell me what you know. I've come to learn about it. But, and he said it very haughtily and and he was very annoyed about things. And he sat down in a bit of in a huff. And so the traditional Chinese doctor, as was custom, brought a teapot and lots of little cups of tea, and he begins to pour into an empty cup some tea. And he keeps pouring and pouring and pouring. And he keeps pouring and pouring and pouring. And then he keeps pouring and pouring and pouring. So the tea is now overflowing and it's going all over the tray. And the Western doctor can stand it no more. The Western professor of Western medicine can't stand it anymore. And he says, he blurts out, says, "Stop, you fool. What do you think you're doing? It's overflowing." To which then the Chinese doctor stops and looks at the professor of Western medicine and says, "See, exactly," he says, "how can you learn anything new if your cup is already full? So, because you have to first empty your cup. If your cup's full with all your thoughts and all your ideas, and how are you to learn anything?" So that's my little story. So you were talking about using things in pregnancy, using acupuncture and acupressure in pregnancy. If you're worried, don't use them. The evidence base for acupuncture in pregnancy suggests that most points are fine, that no one's ever, they do talk about inducing pregnancy with lots of different points. So the best thing to do is to, if you're worried about pregnancy, avoid doing it or do it very gently. There's nothing wrong with massaging someone's back. All the other points, if you do think that you're worried about early delivery and things. People in pregnancy are really sensitive, and about this time, it just depends on what they want to do. Right? I can tell you for a fact that there's nothing wrong with doing a nausea point and with the neck point. The rest of the points, the spleen 6 point, some people do talk about not using it. They talk about not using the large intestine 4 point in pregnancy. Like I said, there is no evidence that suggests that it will shorten the pregnancy at all. So let's see if there's any other questions. So it says, do we need to stimulate pressure points on each side of the body or just the sides you demonstrated? Well, they're both, no. Wherever sore, you can do it. You can do it either side, you can do it both sides, ideally both sides. Usually one side is more, if you have aches and pains, usually one side is more sore than the other side. And very strange, like I said, if you use acupressure or acupuncture on a side that's not painful compared to a side that's painful, you will still get relief. So I would use your experience from massage. You don't like someone just massaging one side of your body, do you? You like it symmetrical, and you'd quite like them to do both sides of your body. If you think there's more benefit from doing longer on one side, then do it longer on one side. So if you watch, so the Chinese acupuncture, Chinese massage is called Tui Na. Tui Na. Tui is push and na is pull. So it's a lot of pushing and pulling. So you'll see for Chinese elbow, it's up and down, moving, and it's quite usually a bit of an aggressive massage, and it's a bit of stretching, and you might do it in the direction of the muscles, which are often the direction of meridians that pass through your body. You do it in the direction, just like if you have any massage in any culture, you will find that some people have all sorts of different forms of manipulative therapies. You've heard of shiatsu. You've heard of there's Chinese massages, Ayurvedic massage. There's this. I've been to Sri Lanka. Every country's got their own form. I'm originally from Malaysia, and they use their own massage there, and that's again very, very quite aggressive massage. And they have stories about the blind who can develop a feel. So if you do it long enough, and like I said, the best place to find these knots is in your shoulder, and then soon you'll be able to find it everywhere. And it takes years to develop this sensitivity in your fingers, but if you've got nothing to do at home, like I said, what are you going to do? What are you going to learn during these times when you're at home? Just learn and develop yourself, feel better, and I hope that helps. So unless there are any further questions, perhaps we can end this a bit earlier now. Thank you very much. Good. You're welcome. Thank you. Have a go at home. Thanks for joining. Thank you, everyone. So please join all the Health Fix videos. There's so much good content. It's so wonderful to see everyone. Thank you. Bye.